My name's Lauren and I'm a Trainee Nurse Associate. So the area of the NHS that I work in a doctor's surgery, which is primary care. I'm in my second year of the Nursing Associate course and I've progressed from a HCA, so I've worked here for about 4 years. My journey as a nursing associate has been really positive. I love the balance of being able to go to work and learn at university. I've learned so much over the short period that I've been doing it, and I feel like my confidence has just completely grown and the skills that I've learned are just amazing. On a daily basis, I do quite a lot of varied tasks, so I can do ECGs, phlebotomies, vaccines, so intramuscular injections, and I do a lot of physical diabetes reviews, and I also go to patients' houses to see them and do checks in their house, which they might not be able to come to the surgery and have, which can be quite limiting for them, so it's really nice to be able to go to their house and provide the care that we can in surgery. The role that I'm currently doing, it takes a lot of pressure off of my colleagues and just the wider team that we have in the surgery. All the things that I can do are the more routine tasks that are still really important for our patient care, and it allows our nurses and doctors to deal with patients who are slightly more complex, but we still want our patients to be cared for and still have a high level of care. In my role, there's quite a lot of things that I enjoy. I do like the journey of learning and being able to practice in the real world and seeing patient real cases. It does make a difference to the patient, and I really like seeing the outcome that we have made a difference, no matter how small it is to them, but we have made a difference, and I'm learning all the time. There's always new things to learn, and it's so nice to know that I'm building all my knowledge. So working in the NHS, there are the obvious challenges with the staff pressures, etc. But the biggest challenge for me was balancing uni and work and still practicing in the real world in my doctor's surgery. It can be difficult to manage all of these things at once, but organisation is definitely the biggest thing to helping you ease them pressures, and it does get easier. Once you get used to it and you know your dates where you're going to placement, it does get a lot easier to manage. In my role and at university, there is a lot of support available. So at university, we have a personal tutor that reviews us every 12 weeks just to check on us, see how we're getting on, and we set some targets that we want to learn, and it's really satisfying seeing that you've met them targets, just about things that you personally want to learn. We have the wellbeing support at uni, which is there for anything that you're struggling with. And a lot of my fellow colleagues have additional needs, and the university are fantastic in supporting them, just making sure they've got some extra support through their journey and that it doesn't limit them at all in their practice. I have a practice assessor at work as well, who I can always ask if I need anything, need any advice, and she always supports me to learn more. We're always going on courses just to expand my knowledge and improve my skills, which is what we want to do. I applied for the Nursing Associate course because I was previously a healthcare assistant in the doctor's surgery, and I wanted to progress my skills and my knowledge and gain a foundation degree. I've always loved working in healthcare and I love making a difference to somebody. It doesn't matter how small it is, but it gives a lot of job satisfaction. So after I've qualified, my plans is to improve more skills, so I'm planning to go on a cervical screening course and to do child immunisations. Since the pandemic, it's never been a better time to join the NHS. There are so many advantages to working in the NHS. You have a great team and you're always really appreciated through patients and through your colleagues, so there's never been a better time to join.